Hi everyone, let's go on our journey to explore about infertility and its treatment, which is in vitro fertilization (IVF). This is our group members.
Infertility is the inability to conceive after a year of unprotected sexual intercourse, affecting millions globally and impacting individuals, family and community. Male infertility can be due to issues with semen, sperm count, morphology or mobility. Female infertility can result from various reproductive system disorder. Both men and female face emotional challenge with infertility, with male finding it harder to express. Psychological effects of infertility are significant, emphasizing the need for supportive service in assist reproduction. Infertility rates are rising worldwide, with the World Health Organization estimating 1 in 6 people affected. In Malaysia, fertility rates have decreased from 4.9 to 1.7 children per woman between 1970 and 2021. Now, we are going to look at the statistic of historic total fertility rate of Malaysia since 1950 to 2024. Malaysia has seen a decrease of the population fertility rate since the 1950s from 6.4 to 1.8 birth per woman, a decrease of negative 72.33% in total. The current population fertility rate of Malaysia is 1.7637 birth per woman, a negative 0.6% decrease from 2023, when the fertility rate was 1.7743 birth per woman. In the future, Malaysia fertility rate is projected to decrease to 16547 children born per woman by the year 2100, a total decrease of the fertility rate of Malaysia by negative 6.18% from today's standard. We're gonna look at the factors of infertility for male and female. The first one is age. As women age, fertility decrease, especially after 37. Infertile older women often have fewer eggs or health issue. Men over 40 may also be less fertile, leading to genetic issues in offspring. The second factor is tobacco use. Tobacco use during conception and pregnancy can lead to infertility, miscarriage and erectile dysfunction in both partners. The third one is exercise issue. A lack of activity contribute to obesity, which increase the chance of infertility. Ovulation issues are less commonly associated with regular, rigorous, intensive activity in women who are not overweight. The last factor is alcohol use. Alcohol harms fertility in women during conception and pregnancy. Men's excessive drinking reduces sperm count and sperm movement.
In vitro fertilization is technology that sperm and eggs are fertilized outside the human body. It is a complex process. After several days, the egg will be inserted into human body. The first procedure is birth control pills and estrogen. This is used to make sure your body is ready to have in vitro fertilization process. So you may have an advice from doctor. In a natural cycle, a healthy person of reproductive age typically matches only one egg per month, while the others disintegrate. During an IVF cycle, injectable hormone drugs are used to stimulate the maturation of multiple eggs simultaneously. The dosage and type of this drug are customized based on individual factors such as medical history, age, AMH levels, and response to previous ovarian stimulation. During egg retrieval, a healthcare provider uses ultrasound guidance to insert a thin needle through the vagina into the ovaries, extracting eggs from each follicle using a suction device. The eggs are then placed in a special solution and incubated. Medication and mild sedation minimize discomfort during this procedure, which occurs 36 hours after the final hormone injection, known as the trigger shot.
Soon after the egg retrieval, all the mature one will be fertilized by embryologists through intracytoplasmic sperm injection or ICSI. While the immature one cannot perform this procedure, they are placed with nutrient together with sperm. Immature egg hardly ever finish maturation process. If it does occur, sperm can then attempt to fertilize. Embryo's development will be monitored for several days. After a certain number of days, the appropriate embryo will be preserved for future transfer. Embryos transfer divide into two, fresh and frozen. Fresh embryo transfer take about 3 to 7 days after egg retrieval, while the frozen embryo transfer will be diluted first after it froze for a long time before inserted when the times come. This method frequently resulting live birth. Last but not least, pregnancy takes place when the embryo successfully implant into the uterine lining. There are also be follow-up to the patient to identify pregnancy after several weeks.
Making a baby isn't always easy. Fortunately, there are many ways to parenthood. In vitro fertilization, or IVF, brings the miracle of conception into a laboratory. It has led to the birth of nearly 10 million babies since the first successful fertilization procedure in 1978. So how does it work? Let's take a closer, step-by-step look at the process. Step 1. Preparation. The IVF treatment process begins long before any egg removal and fertilization takes place. You'll need a thorough medical history before treatment begins, plus fertility tests and analysis for you and your partner. As the procedure gets closer, you may be prescribed birth control pills or estrogen to control the timing of your menstrual cycle and maximize the number of mature eggs available for retrieval. Step 2. Ovarian stimulation. During a typical ovarian cycle, only one egg becomes mature enough to ovulate. IVF treatment uses injectable hormone medication to bring a group of eggs to maturity to increase the odds of a successful pregnancy. The type, dosage, and frequency of the medication will be tailored specifically to you for optimal results. Monitoring of the eggs may occur daily or every few days during this time to determine when they mature. A final trigger shot is given exactly 36 hours before the scheduled egg retrieval to finalize the maturation process. Step 3. Egg retrieval. Once the eggs are mature, it's time for egg retrieval. During this step, a suction device connected to a long, thin needle is inserted through your vagina. This will puncture ovarian follicles and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator for a short period of time. Since this procedure is mildly invasive, medication and sedation are used. Step 4. Fertilization. Fertilization of the eggs takes place within a day during a procedure known as an intracytoplasmic sperm injection. A single sperm is introduced into each mature egg. On average, about 70% of mature eggs will successfully fertilize. Step 5. Embryo development. Now comes the growing and waiting. Fertilized eggs are monitored and left to develop over the next several days, with cells actively dividing. About half of fertilized embryos will progress to the blastocyst stage when they are suitable for transfer into a uterus. Embryos that are suitable for transfer can either be used right away or frozen for future transfer. Step 6. Embryo transfer. Within a week after fertilization, it's time to transfer the embryos. This is a short procedure that only takes about 10 minutes and feels very similar to a pelvic exam or a pap smear. A speculum is placed within the vagina, and a thin catheter is inserted through the cervix into the uterus. An embryo or embryos are then injected through the catheter into the uterus. After an embryo transfer, you may experience symptoms such as mild bloating and cramping, breast tenderness from high estrogen levels, spotting, and constipation. Step 7. Pregnancy. Within 14 days after the embryo transfer, a blood test will be done to determine if you're pregnant. If the pregnancy test is positive, you begin the journey of prenatal care. Pregnancy success rates per embryo transfer vary depending on the age of the woman at the time of egg retrieval. If the pregnancy test is negative, you can try another embryo transfer if you have additional embryos frozen from the first IVF cycle. If you do not have remaining embryos, you can try IVF again. IVF has been used successfully.
In conclusion, all assisted reproductive technologies are permissible in Islamic law as long as the sperm. So, here's a few ways to increase fertility. The first one is we must get active to get a healthy weight. Being too overweight or too underweight can keep you from releasing eggs called ovulation and having regular cycles. Next one, we need to consider limiting caffeine per day. Next, we need to minimize refined carbohydrate. The last one, we need to eat a bigger breakfast. Eating a substantial breakfast may help with female, particularly if you have polycystic ovary syndrome (PCOS), major cause of infertility. 2013 study found that eating a larger breakfast may improve some of hormonal effect PCOS that affect fertility. Did you know that the first successful IVF procedure in 1978? Since that, the Islamic religious community has extensively discussed IVF, whether it is allowed or not. So, the answer is yes. Artificial reproduction is not stated in the fundamental Sharia sources. Yet, when procreation fails, Islam promotes treatment. Thus, attempts to heal infertility are not only permitted but encouraged. All assisted reproductive technologies are permissible in Islam if the semen source, ovum source, and incubator uterus come from the legally married husband and wife during the course of their marriage. However, there are several rules that we need to consider while doing the IVF treatment. The first one, IVF must be done with the husband's sperm. Next, only physicians are allowed to perform IVF treatments and procedures. And the last one, artificial insemination as long as the husband's sperm is used.
لله ملك السماوات والأرض يخلق ما يشاء يهب لمن يشاء إناثا ويهب لمن يشاء الذكور.
To Allah alone belongs the kingdom of the heavens and the earth. He creates whatever He wills. He blesses whoever He wills with daughters, and blesses whoever He wills with sons.
So based on the ayah above, we as a Muslim need to believe that Allah has created this world and He can bless whoever He wills with daughters or sons. Even the mother has no idea what is being generated in her womb. So we need to be grateful with our children and love them just like our parents love us. Because there are couples out there who are struggling to have a baby, so we need to be thankful with Allah subhanahu wa ta'ala gift to all of us.
Here are some references that we use to complete our research about infertility and its treatment, which is in vitro fertilization (IVF). I think that's all from us. Hope you guys enjoy it. Thank you for watching.